Good day and welcome to another episode of Debunking the Myths with me, Luvuyo Mdeni, the show where we really dissect what you've seen on social media regarding COVID-19. I mean, COVID-19 has changed the way that we do things. Now, as South Africa enters another level of the lockdown, things have become very interesting and we've gotten to know more and more and more about this virus. And on today's program, we're joined by Professor Gavin Churchyard. Professor, good day. How are you?
I'm very well, thank you. And yourself?
I'm very well, thank you, Prof. Prof, it's been very interesting couple of weeks. COVID-19 has taken over our lives. How has it been like for you specifically?
So we've faced challenges as everyone has done, but we have been in a very privileged position where we have been able to support government in the response to COVID-19. And so we have 80% of our more than 3,000 people working for us as frontline workers out in the field, doing screening, tracking, tracing, and preparing to do some of the important research for COVID-19 to find treatment, vaccines, and prevention.
We call this show Debunking the Myths, and what we do is we invite our Facebook audience to send us questions and sometimes invite them onto the show. And through these questions, we then interrogate if this is completely true or it's just myths doing the rounds on social media. Now, on today's show, I'm joined by Sizwe. Sizwe, good day.
Hi, good day, sir. How are you?
I'm good, thank you. Sizwe, you had a question that you wanted to ask the professor, and this relates to your face mask. Please go ahead and ask the professor your question.
Okay, Prof, I have a question here. I've seen a picture circulating on social media about the two types of mask. The one is the surgical mask, and the other one is a cloth mask. So now it is said that the cloth mask is not effective compared to the surgical mask. They say the surgical mask is more effective than the cloth mask. So that's my question. How true is that?
So thank you for asking this very important question. And in fact, there's actually a third type of mask. And this is a mask that is very effective in preventing us breathing in any form of the virus. So the cloth mask, the surgical mask, and these more specialist masks serve different functions. So the cloth masks and surgical masks are more important for protecting other people from infections that we carry. So that's why surgeons wear them in the theatre. It's not to protect them, it's to protect the patients they're operating on from their germs that they carry. And so this whole recommendation is for us to all wear masks because we know that some people may have COVID-19 and be asymptomatic. They're not even aware of it, but they can transmit the virus to others. And so these cloth masks and the surgical masks are effective in preventing the transmission to other people, but both are not very effective in preventing us from getting infected if exposed to someone with the infection. And the least effective of all are the cloth masks. But we're not wearing these cloth masks to protect ourselves, we're wearing them to protect everybody else.
Everybody. Oh, okay.
It works if we're all wearing them because we don't know. There's a lot of people who have the SARS-CoV-2 virus and they don't know it. And so it's helping protect all of us if we all wear these masks. The more specialist masks, the N95 masks, this is reserved for people in the front line, so doctors, nurses, and people collecting all these specimens. They wear this mask because they've been exposed to people with the disease, and so to prevent them from becoming infected. But that's a very good question. Thank you.
There's another thing. Can I ask?
Go ahead.
Okay, thanks. I went to town to buy some groceries, and then I saw one guy wearing a handkerchief. What advice would you give that person wearing a handkerchief?
So, as I said, basically, this is to protect other people. And so a handkerchief is not, it will provide some protection, because what happens is the virus is actually transmitted in tiny, tiny little droplets that we just, as we don't have to cough or sneeze, just by speaking,
yeah.
expelling these tiny droplets. And if that person's infected, the virus will be in those droplets. And so by wearing, even if it's just a handkerchief, it helps block the transmission of those very small droplets into the air. And so it's better than wearing nothing, but it would be better to have a more substantial cloth mask if they have access to that.
Now, this brings me to another question, Prof, that we'll bring onto the screen now. This is something that Simon had asked. Okay, so the question, what types of medication is being used to give people who are in isolation? And is there any cure? And why are people testing negative after having quarantined?
Well, so let me just speak to the last question first. So someone may be exposed, so they may have had a known exposure, and they've been in isolation. So they may test negative simply because they were never infected. Sometimes if they have a negative test and they were also exposed, and they may subsequently be shown to have COVID-19, the test has what we call a false negative. All tests do. And it depends on the performance of the test and how well the specimen is collected. So just because you have a negative test does not definitively rule out that you may actually have the COVID-19. And sometimes the tests need to be repeated before you get a positive test. And then the converse is also true. Sometimes people have a positive test when they actually may not be infected. But the performance of the tests we're using are very good. And for the most part, if the test is positive, that's because people have the disease.
Now, I'd like to bring the last question to Sizwe, since he's been very eager to ask this question. Sizwe, shoot your shot. What's your question to the Prof?
Okay, this is just a follow-up question from the question that you asked about the people who recover after being tested positive. If someone has been tested positive and then he was indeed infected, what is it that you give them after having been quarantined? What is it that you give them and then they recover?
So at this point in time, we don't have any specific treatments for COVID-19. You would have been aware in social media, lots of discussion around some of the treatments, such as chloroquine. And these are trials that are now starting up, but both overseas and in South Africa. And so some of the vaccine trials, the treatment trials, etc., are just getting started. So hopefully we will have, within the next few months to a year, treatment for early COVID disease and for the more severe forms of COVID disease, and hopefully vaccines coming along as well. That will take a longer time frame.
Now, Professor, on a closing tip, I just wanted to find out from you, if you could, you mentioned it at the beginning of the show, but if you could just slightly tell us about the work that the Aurum Institute is doing in relation to COVID-19, and how are you guys helping us overcome this deadly pandemic that South Africa is going through?
Thank you. So we have people contributing to manning some of the calling centers nationally and within the regions. We are involved in facilities, primary healthcare clinics, helping doing testing as well as doing screening and testing in communities, for instance. We have developed and deployed community-based hand washing facilities, because in many communities access to water to wash your hands is very limited. And so we're providing that sort of those facilities in our communities. We've been very proactive in purchasing these masks. They're called personal protective equipment. So it's the specialist masks for healthcare workers, plus these more surgical masks and cloth masks. And we've made 1,000 of our members available to be in communities to help with the screening and testing. And then also going to households of people who've already had COVID-19, screening them and testing them again to see that they have recovered from COVID-19. So we're doing a lot of the the work in a number of provinces to support government.
Well, that was another episode of Debunking the Myths, and today we're joined by Professor Gavin Churchyard, who is from the Aurum, who's the Group Chief Executive at the Aurum Institute. Professor, thank you very, very much. And I'd also like to thank our participant, Sizwe, for being very, very helpful in terms of helping us debunk the myth. And till the next program that we have again, bon voyage.